Did you know that every year 10% of all pregnancies are affected by gestational diabetes? It's diagnosed for the first time during pregnancy. However, unlike diabetes, it's a temporary phenomenon. Normally, a woman recovers from it after childbirth. It's caused because the growing baby produces various hormones in the body which inhibits the production of insulin. Remember that insulin is what allows the glucose in the bloodstream to reach the cells and use it as fuel or energy. So, if there's no insulin, the blood sugar levels rise, and that is diabetes. Normally, gestational diabetes can happen to any pregnant woman, but there are some factors which increase the risk of developing it. For example, if the woman is 35 or older. If she's obese, well, excess weight before pregnancy often plays a role. If she had gestational diabetes in a previous pregnancy, if she gave birth to a child weighing more than 9 pounds during a previous pregnancy, if she has prediabetes or insulin resistance, if she suffers from polycystic ovarian syndrome, and if she has a history of diabetes in her immediate family. Remember, it's a temporary phenomenon and the mother can fully recover from it. But what happens if we don't diagnose it and if we don't treat it? Well, the most feared complication is stillbirth, and that's why checking for gestational diabetes is always part of your prenatal care. Your doctor will always check for it. Another complication is that your baby can have excess birth weight, 9 pounds or more, and this can bring complications in the delivery. He could also be at risk of preterm delivery, and statistically, babies that are born too early have respiratory diseases. Sometimes the baby can experience low blood sugar shortly after the birth. This is called hypoglycemia. And later in life, these babies have a higher risk of developing obesity and type 2 diabetes. Having gestational diabetes can also increase your risk of having high blood pressure, preeclampsia, and you're also at risk of developing type 2 diabetes in the future, and gestational diabetes in future pregnancies. The good news is that gestational diabetes can be managed very good if it's diagnosed early. That's why your doctor screens for it in every appointment you have. It's part of your prenatal care. So with that being said, the first recommendation is to go to all your checkups. The more healthy habits you can adopt before pregnancy, the better. If you've had gestational diabetes, these healthy choices can also reduce your risk of having it again in future pregnancies or developing type 2 diabetes in the future. Number 2, eat healthy foods. Choose foods that are high in fiber and low in fat and calories. Try to focus on fruits, vegetables, and whole grains, and watch your portion sizes. Number 3, keep active. Exercising before and during your pregnancy protects you from developing gestational diabetes. Now, unless your doctor has recommended you to rest, aim for a 30-minute of moderate activity most days of the week. Take a daily walk, ride your bike, swim a few laps. Remember that every little bit counts. Short bursts of activity, like parking a little bit further away from your store or taking a short walk, it all adds up. Number 4, start pregnancy at a healthy weight. If you're planning to get pregnant, losing extra weight beforehand can help you have a healthier pregnancy. Try to create eating habits that you can continue during your pregnancy, like eating more vegetables and fruits. Number 5, try to not gain more weight than recommended. Of course, you're going to gain some weight during your pregnancy. This is normal and healthy. But gaining too much weight quickly increases your risk of gestational diabetes. There's no rule that says how much you should gain. And if you're struggling with extra weight, ask your doctor to refer you to a nutritionist specialist. This will help very much in keeping your blood glucose levels in check. If you've already been diagnosed with gestational diabetes, your doctor has probably already referred you to a diabetes specialist and has probably already started you on a diet. The first stage of the treatment includes diet and monitoring your blood sugar levels at home. If this is not enough to keep them in a normal range, the next step is medication. Now that your baby arrived, what now? Well, congratulations. If you had gestational diabetes, usually your blood sugar returns to normal soon after the delivery. But you do have a higher risk of getting type 2 diabetes, so you'll need to be tested more often. So that's all we have for now. I hope you found this information useful. I'm Dr. Carolina Melgar from Sono Health. If you have any questions, feel free to leave them in the comments below. Thank you for watching.